Uh, Nikki, can you turn the music? All right. So let's start. You know, it's already 6:10. The form that you have in your seat, there are two forms. One is a yellow flag. That's a risk assessment. So once you fill out, you know exactly what is your risk. Because based on the risk, we can manage properly. Because high risk, low risk, medium risk. There are three ways to find out. What does it mean? Low risk means, yeah, you can manage yourself if you fall on the low risk. If you fall in kind of a medium risk, then you need something like, you know, immediately like physical therapy, yoga, or whatever kind of like, you know, approach is best for you. If it's a chronic, you're like, you know, in the third stage, you wanted to really have the comprehensive approach. When I say comprehensive, means like, you know, based on your diagnosis, we have to kind of approach from all the direction. It could be doctor's visit, ortho, imaging, physical therapy, everything, okay? So that's why this one is the self-awareness form. So you can keep it to yourself. You don't need to share the results or anything, but at least that will give you some idea that what it is, you know? So in that way, you know where you fall. Today's session, I'm going to be focusing more on how you manage the back pain at home. How do you manage yourself? Because many times people has a back pain on and off, okay? And when we have a session, many of you, I have already seen you, and some of them like kind of new, but like, you know, that I always talk about the ergonomics. So when we're doing the session, we're trying to explain, but here I'm going to go more in detail about like what you need to do, what you need to pay attention. So in that way, you can start with that, okay? Because these are the permanent solution. If you follow this, all the steps that I'm going to go through today, you can manage yourself. You don't need anybody else. But now first stage is to identify what stage you're on. Okay, because your back pain, you have a back pain, but what stage is it? Like, do you need to know that where you fall? Okay, so we'll go from there. So we'll start with a red flags. Okay, so when someone come here for physical therapy, first thing we find out is that they don't have any kind of severe diagnosis that we cannot treat. Those are called red flag. The red flags are basically malignancy. If someone has a tumor, okay, on the back. So when right now I'm just gonna, we can do that, but when it comes to the picture, I can do that, you know, because right now I'm just gonna talk a little bit about it. Let's see if we can turn on and if you're okay with that. Is it okay? Yep. Okay, then we'll leave it like that. Huh?
I didn't know there was anything on the screen. I couldn't see it.
Yeah. All right. Okay. So the red flags. The red flags, as I said, like, you know, if like a malignancy, okay, or infection of the spine, like ankylosing spondylitis. If someone has ankylosing spondylitis, we're not gonna work on that. We have to do more further diagnosis for it. Okay. Spinal fracture. I'm just gonna go this way so you guys can see it. Okay, better? Okay. Okay, so as you can see, spinal fracture, quad-equina syndrome, that's kind of a, like, you know, that extra spinal cord in the bottom, like in the tail side. But that's, again, all those are red flag. So we just rule out sometimes if we come, the patient comes and we have severity of the symptoms, then we go from all those symptoms to make sure that they don't have any of those things. This is rare, okay? So those kind of things are rare. It's not that common to have that, okay? All right, simple, okay. How many of you have a simple back pain? Like, what is simple back pain, you know? So when we say simple back pain, because many people think, okay, I have a herniated disc, I have a stenosis, I have a degenerative disc disease, I have a listhesis, you know, all those kind of fancy words. Those are all fall under the simple back pain, okay? When I say simple back pain, means your nerve is not involved. When your nerve roots are not involved, all those things we can consider as a simple back pain, except that red flags. Okay, so when I say simple back pain, that means you do not have the symptoms radiating down to your leg. Okay, there is nerve root involved that shoots down the pain. There is more like a numbness, tingling. Those are different kind of pain. okay? But the simple back pain, as I said, like in the nerve roots, implies that the nerve roots and spinal cord are not compromised, okay? Simple back pain can be very painful, so don't take it like, you know, that, okay, simple back pain, oh, it's a simple. It's not anything simple about it, okay? So simple back pain can be very severely affecting your daily life. It can radiate down to your leg. It can refer the pain to your hips, to your thigh, but it normally does not radiate down to your knee. It radiates up to the knee, okay, not below the knee. If someone has like glutes pain, like it refer down here, sometimes in the thigh, those can be a simple pain as well, okay? So at that time, if someone has that kind of pain without any red flag, probably in the first month, we don't go for the imaging. Because anytime when patient comes with the back pain, they wanted to find out. So first thing people say, okay, let's get the MRI. When we see the patient, we said, okay, no, wait. Let's try something first, okay? If that doesn't work out, then we can go for the imaging. But first, if it's a simple back pain, we can manage. We can conservatively, we can manage, okay? So nerve root pain, as I mentioned, like, you know, that normally the nerve roots are unilateral. That means your pain is more on the one side than the other, okay? Your one leg is shooting down, the pain is shooting down to your leg. Many times, the pain is uncontrollable in the leg. More than the back pain, you may experience more like a leg pain, okay? So your back pain is fine. Like you're not like, okay, I'm suffering with my back pain, but my leg is really like, you know, suffering, like, you know, having kind of weight pain. It's hard to explain kind of pain. Goes on your feet, goes on your toes. It can go in your leg, okay? So those are the nerve root pain. And those are hard to treat. It takes some time to treat those patients, diagnosis. There are some special tests that we do to find out, like SLR test or slump test. So what are those is basically we simply ask the patient to raise the leg up. It's called straight leg test, okay? It's SLR, straight leg raise. So when you raise your leg and if you have a symptoms at certain degree, so based on the degree, we know exactly, okay, if you are under 40-degree, possible involvement of this nerve root, or like, you know, 70-degree, different. So depending on the level, we can find out more. Slump test is basically we find out if your spinal cord is involved. So we stress the spinal cord and we do certain tests, certain movement to find out whether that is involved or not. So how many of you know dermatome? Anybody knows dermatome? So this is what we find out when someone comes with the radiating pain down to the leg. First thing we see, as you see, there's a different numbers around here, L3, L4, L5, L2, L1. So when someone comes with, and that's the reason that when someone comes with the back pain, first thing we do is, okay, where exactly do you feel the symptoms? Do you feel in the front side? Do you feel more on the back side? Do you feel on your feet? Do you feel on your thigh? Because based on that, so if someone said, around thigh, I'm feeling that kind of numbness or tingling, then L4 is more involved. So in L4 is more like, you know, your nerve root. I came across one joke yesterday, so I'll just share with you. That was funny. So one person said, what is L2 and L3? Okay, so what is L2 and L3, like here? So they asked the nurse, what is L2 and L3? The response was L5. 2 and 3, 5. So that was funny. But anyhow, so we find out the label based on the dermatome. So then, why it is important to know that? Because once we know the label, we can work on it. We can decompress that label because we know the landmarks, like how to find L2, where is L4, where is L5. We can work some manual therapy. We can work some decompression. But now we know exactly where to work on. So that's why the dermatomes are very important. And the myotome is basically the nerve root supply to particular muscles. So if you have visited to the orthopedic doctor or physical therapy center too, we check like a jerk, like patella jerk, okay? So based on that, we can find out which nerve roots are involved. That's called myotome. Now this is very important, phase of care. So how do you know what stage you were at, okay? You may have pain for years, okay, but sometimes it clears up. So there are 3 stages: acute, subacute, and chronic, okay? Acute is anything within 4 weeks. That's acute. Subacute is anywhere from 4 to 12 weeks. And chronic is anything more than 12 week, okay? So basically, this acute phase, you want to do it yourself, okay? So within first, let's say you experience the back pain, you start getting some discomfort in your back, okay? And then it lasted 2, 3, 4 days. You have to be paying, like you have to pay attention at that time. That, okay, let's treat that, okay? Let's work on it before it gets to the subacute phase. Because that subacute phase is a high risk. It can easily convert in a chronic pain. Because when that happens, you got a problem. Then it will hard to treat. If you take care of it, now the thing is, in acute phase, you need to know what to do. You know, so how do you manage? What kind of stretching, exercise, modification, which we're going to talk a little bit later on, that need to do so you can take care of yourself. Okay. If it gets to the subacute, you want to go all in. When I say all in, means like whatever, go for the assessment, go for the consultation, physical therapists or doctors or anybody, but then look for go with the right place and then ask them what are the treatment options and then go for it, okay? Because if you take care of that, even if that's cost effective, the reason is because that time, it will not take longer to treat you. So even though you have to pay some amount in the healthcare system, but you can easily manage that. It becomes chronic, you got a problem. Then it takes longer time to heal. It takes longer time to work on it. It takes multiple health discipline has to be involved. Then it becomes more complicated. So make sure that you understand the stages. You may have pain for years, but as you know that if someone has, you all are here because at some point you might have back pain, right? So you know that it's not all the time there, okay? There are times that 4, 5, 6 months you're fine. There's no issue. But then one day you feel it. That's the time you wanted to pay attention. What do you want to do about it, okay? Now what I tell, the 6 key points to consider. If you follow the 6 points, just 6 points, if you religiously follow this, you will not have to see me. Okay? You can manage everything yourself. Okay? So 6 points, we're going to start with identify back-related worries and fear. Go ahead.
Do we have a printout of your presentation?
I can send you the whole presentation. I can email you. We are doing recording, so I can send you the recording as well. Okay? So the 6 points are very, very crucial because those 6 points we're going to be talking in detail about it. Okay? So the first one is identify back-related worries and fear. The first thing you want to take care is the psychosocial factor. Okay? What are you thinking about your back pain? Okay? Because many times, 2/3 have concern wrong movement will cause serious problem. Okay? So 2/3 of people think that, okay, if I do this, it's going to cause more problem. Okay? Half believes avoiding certain movement is safest way to prevent low back pain. So that, okay, you know what? I'm not going to do this at all. So in that way, I can prevent the back pain. So that's mentality. You have to understand that not both are wrong because you have to identify, and I'm going to go a little bit detail about it further, that what exactly you need to understand. But both are you don't want to avoid certain movements or you don't want to overdo it as well. So understanding the fear that what you're experiencing and understanding that is very important. Okay? All right, the second one is it serious? Okay? So second thing you wanted to find out is that red flags, yellow flag. Okay? Is it red flag? Most of the time it's not because those conditions are rare. Okay? Or is it the yellow flag? Okay? What phase you're falling on? By filling out the form, you can find out that. So this is where, getting strengthened. Many times we get a patient, they walk in, they got the MRI done. Before they've done anything, you already got the MRI. Now they have the label that, hey, I have a herniated disc or I have a stenosis. Heavy word. And then, of course, if someone is medical field, understand, if someone is not from the medical field, they think, okay, I got a stenosis and my life is done. Not necessarily. We can manage. As I said, remember simple back pain? This still falls under simple back pain. Okay? So, they found the cause. Now they want to fix it. Okay, I got the diagnosis. I have the stenosis. We want to find it. But guess what? The study has done where they have done the group of people with the symptoms. They have for example, stenosis or degenerative disc disease or herniated disc. They took the MRI, X-ray, all the report done, and they have a symptoms. And the changes is shown on MRI that, hey, they have a herniated disc, or they have a stenosis. Same, there is other group with the same similar age group. They did the X-ray, MRI, on all the reporting done. They don't have a symptoms. They still have those changes. They still have a herniated disc. They still have a stenosis, but they don't have a symptoms. So what it tells you? It tells you that not necessarily when you have those changes, you should have the symptoms. Why they don't have a symptoms? Why the group of people has a symptoms and some of the group people, even though they have those changes, a herniated disc or stenosis, they don't have a symptoms? Because they learn to adapt. Their body has learned to adapt. Okay, and that is trainable. You can definitely work on that, and you can work get it done. Okay, so you can adapt to those changes. Your body can adapt to those changes, so you can avoid that pain. Okay, so the third one is, what is the cause? You have to find out what is the cause. Okay, so once we know what causes it, we're going to go in detail about that one too, like, to understand that. But as I mentioned about the symptoms versus no symptoms, and then those changes are, both are like, MRI has same results, but one with the symptoms, other without symptoms. Instead of learn to live with problem or compromised lifestyle, learn the things that you can control the symptoms. And I'm going to talking a lot about this modification. I have pictures and everything down the slides, but you need to make sure you modify. I always tell people that I have a herniated disc, okay? But I don't limit myself. I do everything. There are times it flares up, but I know what to do. Okay, I can fix it. I know exactly what kind of modification I need to make it. And that's exactly what everybody needs to learn for the back pain. Most people are overly concerned about doing too much. One of the only factors shows the future back pain is poor back muscle endurance. This is a big point, because many times people think that, why do I get back pain repeatedly? Okay, once you have a back pain, and people who has frequent episode of back pain, they know that once you have a back pain, few months you're fine. You do something that you're not supposed to do, and then your back pain is back. Okay, so that is very important, that the reason is because of the poor back muscle endurance. You haven't strengthened your back muscles, your deep core muscles. You're not stimulating those muscles. And instead of that, many times people come with the steroid. They got the steroid, but what the steroid does? Steroid reduces the inflammation. They're not going to strengthen the muscles. They're just going to, in fact, if repeatedly you got the steroid, in the long term, it's going to affect the ligament. It's going to affect the bone. It's going to affect the vertebra. Okay? So I have a podcast which is on the website as well. So Dr. Stephanie, she's an orthosurgeon. We did the podcast, and we talked about steroid. She did mention that, okay, steroid effect is usually 2-3 months, depending on person to person. But once the inflammation down, you may not experience the pain. But the long-term effect of the steroid on the bone, it does affect your hyaline cartilage. It does affect the bone quality in the long run. Okay, and that's the reason that doctors do not give you usually 2 or 3 a year. They don't offer you more than that. If you go back in a month, they're not going to give you again, because we know that repeated use of the steroid is not good. Okay, most common cause is external load repeatedly exceeding physical capacity. It's simple word, but basically what it means, you're sitting down, okay? The gravity is an external force, okay? Your muscles, the endurance has gone. So now that external force is, the capacity of the muscles are beyond that force. And that's the reason you end up with the pain. So you need to build up that endurance. You need to make sure your physical capacity is more to withstand that load. Okay, fourth one is, what should be avoided? Activity modification and reactivation advice. Now this is where you need to pay attention. I'm going to be talking about modification of daily life. Okay, what do you need to do? Activity modification, reactivation is the most important education. If I stress this so many times, If you do not focus on that, you're going to end up with repeated back pain. Okay? Appropriate activity may not be comfortable, but activity avoidance can lead to deconditioning. Okay? When you are going through that severe pain, many times people stop doing things, which is wrong. You need to do the things, but you need to do it in the right way. Okay? No pain, no gain is also not appropriate, because many times, see, there are different types of people. So stop rule. What's your stop rule? Because everybody's different. So, for example, my mentality, my nature is kind of overachiever. If I have a back pain, all right, I'm going to push it. I'm going to push it enough that I'm going to get rid of the pain. Okay, so even though if I hurt, I will push too hard to do this. And we see this every day, like when we have a patient, there are a few patients who said, it's hurting, but I'm going to push it, I'm going to do it because I want to get better. And there are a few patients that also, they said like, that feels like discontinued. That, okay, no, it's going to hurt more, so I would want to stop. Both are wrong. You don't want to overstrain, you don't want to underdo it too. Both are wrong. So what is right? When you are going through the pain, what should you do? So the best thing to follow is quota-based approach or graded approach. So what I mean by that, let's say you have severe back pain, okay, or moderate back pain. You start doing some exercise. For example, let's say you did bridging or knee to the chest. Everybody knows those exercises. You did 10 and said, no, my pain is more. Okay, I can't do more than 8 or 10. That's okay. Today, you did 8 or 10. Tomorrow, increase that. Increase that next day. Increase that next day. Grading. Gradually increasing the repetition. Gradually increasing the intensity. That's how you wanted to do it. Not too much, not too little, but listen to your body and keep on working on that. Okay, so that is very important to understand. Now, rest versus activity. Now, pain relief options, so rest versus activity. There was a research done, the study compared 2 days of bed rest and 7 days of bed rest. So there were a group of people, they said, okay, you're going to have bed rest 2 days with the back pain, and there were a group of people who has a back pain, and they said, okay, 7 days of rest. At the end of the study, they find out that the people who rested 7 days, in fact, they had more harmful risk because they deconditioned. All the muscle endurance gone down. So it's very important that you follow that like proper exercise, proper activation, proper reactivation. Okay. First thing is to understand what activity to avoid. So you also wanted to make sure what to avoid it, because you don't want to blindly just do everything. You wanted to make sure, like, the trigger points, you wanted to avoid those pain receptors, okay? But also, activity that harm one patient may help other patient. So not, because see, many times when people talk, one person did something to help their back, and they will tell and advise the other person, I did this, help me, you do this. Not necessarily that thing will help you. It can harm you too, or it can help you too. So it depends, okay? But that's the reason that personalized care is very important. Okay, the common posture that easily can be modified. Now we're talking about the modification. So sitting, bending, lifting, standing. Those are the posture we can modify. Now everybody knows that, okay, yes, standing straight, sitting, okay, sit properly, bending, how to bend, how to lift. But I'm going to go in a little bit detail about it so you understand that. The most common aggravator factor is sitting, because we sit a lot, okay? So when we sit, it makes it worse. So now, after only 3 minutes of full flexion, so full flexion means like, this is full flexion. My back is bending. That's a flexion. Flexion means bending. If my back, my spine is flexion 3 minutes, it can last the symptoms, the ligament creeps and laxity happens in my ligament, and that can last up to 30 minutes. So 3 minutes of strain, the flexion of the spine, can feel up to 30 minutes. So it takes our body to recuperate 30 minutes just after like straining, or not even straining, just flexing those spine to 3 minutes. Okay? So think about that. Even if the static posture is not strenuous. Now sitting is not strenuous. But what is static posture? Static posture is basically you're in one position. Standing, this is my static posture. Okay? Anytime you're not moving, those are static, like driving. sitting. You're not moving around. Those are the static posture. To stand up, do you think I'm not using any muscles? I do use my muscles. So when you have a static posture, you still use the muscles. So you see 4% of maximum voluntary contraction occurs that can trigger negative metabolism. What does it mean? 4% of the maximum voluntary contraction means my static posture when I'm contracting, if my posture is bad, and only 4% of the contraction happening on those muscles that are required to maintain that posture can trigger the negative metabolic rate. And that's the reason people feel stiff, pain. When you sit like, you feel comfortable. Okay, my back is okay. All right? But then that can trigger the negative metabolism and that can lead to more pain. This is something you might not heard about it in the past. This is something very fascinating. One of the studies suggests 54% of the loss of the disc height occurs in first 30 minutes of rising, means once you get up in the morning. Okay, 50% of that. Disc bending stress or increased 300% and ligament by 80% in the morning. So what it means that when you wake up in the morning, throughout the night you're resting. Okay, when you wake up in the morning and any wrong posture, or not even wrong posture, just normal activity of daily life can put extra pressure on the spine. That's the reason many times people feel pain more in the morning. And those are the times that are very crucial to start working on your posture. If you take care of the morning, throughout the day, you will not experience the pain. Now, many of you start straining the back just by getting out of the bed. People don't do the log rolling. Everybody knows what is log rolling? You know what is log rolling, right? The log rolling is we turn our body as a log. The log, the wood log, is just turned the whole log. That's why it's called log rolling. So our body, I'm going to show you the image soon. But the log rolling means you're not, because many times when you're trying to get up, you're just trying to get up like that. You're straining your back. Okay? So you want to make sure in the morning you pay really good attention your posture to do not put any strain on your back. Now, this is the exercise you want to do every 20-30 minutes when you're sitting throughout the day. This is called the Brueggers relief position. Okay, so this really takes the pressure off from your back and your neck. So let's say you're working. I would say 20 minutes. Okay, you can do it in standing posture or in sitting posture. So all you're going to do is stand up, extend your hand, go back, stretch it, and breathe. Hold 10 to 20 seconds and relax. You can do same thing in the sitting, okay? But that will take the pressure off from your back and neck, both. So this you want to do in between if you're sitting too long, okay? Now, recovery expectation. I'm going to show you all the pictures now, but everybody has one question. How long it takes to take care of my back? My back is hurting, how long it takes? Now, the time frame is different, but one thing that we have done, the research suggests, if you did the physical therapy treatment or chiropractor or any kind of other treatment, in the first session, if you start feeling better, the chances you're going to get better is within 2 weeks. Within 4 sessions, you're going to feel better. Okay? But if someone has a chronic pain or someone has a severity, like, pretty bad pain, and if they don't respond well, their stage is already like, in the chronic stage, and first session they feel a little bit better, not much, then most probably they're going to go with more sessions, longer period of time. But if someone responds well in first treatment, we're looking at like 2 weeks, 3 weeks, that's it. You're feeling much better in that time. So this is log rolling. Okay, so this is how you turn on the side, you push your arms here, and then you get up. That's how you do it. Now, think about it. As I said, morning is the worst. That's where you start hurting. How many times we brush like this? We go in the bathroom, we lean forward, and we brush our teeth like that. That strains the back. You don't feel it right away, okay? But it does affect. That's unknown factor, but those are the things you want to pay attention. So what do you want to do? Either just stand straight or put one leg on the top. If you have a stool or something, you want to modify that. Standing up from the chair. We do that all day long. We sit down, stand up, sit down, stand up. So the difference between those three pictures is if you look here, the back is curved. Okay? So when your back is curved, we don't pay attention when you try to get up. We just lean forward and trying to get up. When you lean forward, you're putting strain on your back. You want to make sure you keep your back straight, use your hip, and then trying to get up. You want to bend forward. So this posture, you see the stick here. So this one is wrong. The reason is because the stick is coming up from the back. Okay? So you want to bend from the hip, not from your spine. When you're picking up something, when you're leaning forward, get in the habit of flexing from the hip, not from the back. Okay? Activity modification again. When you lean forward to clean your face, okay, versus bend your knee and hip. Okay? Because when you lean from the back, again, it's strain. Your core position, when you're driving, we lean forward sometimes. So two ways you can do it. Either adjust the chair or you have a cushion in the bottom, depending on the car you're driving. I have one cushion on the car because my seat is kind of deeper. You know, and as I mentioned that I do have a back pain too. I herniated my disc. So I'm following all those ergonomics, so I drive a lot too. So I make those kind of changes. You know, so in that way, it doesn't affect my back. Wearing socks. What we do, either we stand up and trying to lean forward and wear the socks, or we sit down, okay, and then lean forward to wear a socks. Instead of that, make sure you use your hip, not the back, or have a stool, put your leg on it, and you can do it. Okay? Same thing, everybody knows when you lift something, keep it close to your body. Don't keep it far. Okay? Grocery bag. When we go there, we get the grocery, what we do, we compensate the weight. We hold the weight, but because it's gallon of milk or something heavy grocery, so we walk like this. So when you walk like this, think about the back. It moves on the side. Those are changes, it's very small, minor. As you notice, like those are minor changes, but that can affect your back. That can really strain your back. As I mentioned, like starting from the morning, you need to make those modifications. Now, these are the very generic modification, but based on your body type, based on your back pain, your modification might be a little bit different. Okay? But you need to start making those changes. Now these are, if someone has a severe back pain, they're still okay to do this kind of exercise. Okay? These are very basic exercises. As I mentioned that if you don't do anything, you got a poor endurance. You wanted to start doing some exercise. Knee to the chest. Safe to do it. Even if you have except the red flag or something. But if you have a severe pain, not radiating down to your leg, you just have simple back pain as we discussed earlier, you can just do this. Okay, Cobra pose. This is modified Cobra pose. So as you see, the arms are forward. It's not straight, but it's a little bit forward. Okay, so in that way, not putting too much pressure on the lower back. Cat and camel. Very basic exercise. But why it's important? Because it works your pelvic. Okay, your sacrum is connected with your pelvis. So when you do cat and camel, you're adjusting, you're aligning your sacroiliac joint. Okay? Your spine is connecting with your back. The hip. Okay? So that exercise helps you with that. Single knee to the chest. That helps you with your SI joint. When you do both knee towards you, you're flexing your lumbar. You're flexing your lower back. When you do single leg, it affects your SI joint, which is your sacroiliac joint, which is the sacrum attaching with your hip bone. Side rotation of the trunk, so that just stretch your lower back. Those are safe exercises to do it. Now, common conditions that people experience in simple back pain, not simple, but like sciatica is the nerve root involvement, because sciatic is a long nerve that goes from your lumbar, normally L4, L5, all the way down to your leg. And that get inflamed, that get pinched on the back, that's why it's called sciatica. okay, because it's radiating down. Piriformis syndrome. It mimics the symptoms of the sciatica, but the piriformis is the name of the muscle. That muscle goes on your glutes, like around the glute area, so that the sciatic nerve passes through the piriformis, okay? And when that is tight, that's why you must have seen that exercise, the PG, like, cross the leg and kind of bend it. That's for piriformis stretch. Degenerative changes. Basic term, arthritis, you still can manage, get some mobility exercise, get some flexibility exercise, that helps. Spondylolisthesis is basically one spine is forward or backward over other. That's called listhesis. Stenosis, narrowing of your spine. Your spinal cord got narrow. You can still manage it. Herniated disc, sitting too long, it pushed the pressure on your herniated disc and it kind of prolapsed in the back. Prolapsing back is the most common one. What do? 4 things you wanted to work on: mobility, flexibility, stability, and strength. So 4 things that we need to work on. So mobility, we can check by certain tests whether you have a mobility issue. Flexibility, we can again do some tests to find out if your muscles are tight, or so mobility is like if you have a limitation in your spine. Flexibility, if your muscles are tight. Stability, if you're weak core. Okay, we can still do some tests to find out that. Strength is just strength of the muscles. We can still do some crunches, sit to stand tests to find out those things. The best exercise, so someone has not severe problem. They have kind of on and off problem. You want to focus on those 4 things. Deep core activation, many times people don't have that, as I mentioned about the poor endurance, you need to activate those deep core muscles. There are some exercise, if you are particularly interested, let me know, I can send you. Lumbar mobility exercise, there are ways we can do it. For example, scorpion stretch. You lay down, face down, and you just move your leg sideways. That's a scorpion stretch, okay? You can do some lumbar mobility exercise. Deep stretching exercise, like a QL, your quadriceps lumbar, which is a deep muscles in your back. So you can go hold the wall and you can just stretch it on the side. So that helps you with your QL. Foam roller use. This I use myself very often because it helps to release the myofascial, on the back, release the tension in my muscles. So I use it very often. When you feel like, when you're sitting too long, feeling tight, stiff, foam roller helps. All right, so conclusion is, determine what phases of the pain you are in for a back pain. Understand your back pain and start back pain management in acute phase. First one is a magic number to work on yourself, okay? Activity modification is the key for long-term management. Reach out to a physical therapist to understand activity modification. To your specific need, you need to go in detail. So how do we help? As a physical therapist, SureCure, we do free consultation. Anybody has any back pain, we do free consultation. If you want to talk more about the modification, we can do that. Postural assessment, we find out what muscles are tight, what muscles are loose. We have software that we can use. We have some special tests we can do to find out that. Manual therapy, we do in the therapy session. We can work on your spine once we find out the level. Cupping therapy, as many of you know, we can work on your muscles, the tightness, it helps a lot. We do dynamic cupping, we put the cup on your muscles and then we perform some movement. Dry needling is similar to acupuncture, but dry needling really helps with the inflammation and tightness and trigger points, okay? Shockwave therapy, if you have more ligament issue, the shockwave helps a lot, okay? So if someone has the ligament issue on the SI joint, or like lower back, like on the spinal, the vertebra, something like that. The shockwave therapy helps on that one. Infrared sauna helps with the tightness. If someone has a chronic pain, like chronic tightness in the lower back pain, so that helps a lot. So these are dry needling, shockwave, cupping. Okay, so what we're gonna do, we can turn on the light now. So today, okay, first of all, before we go in that, any question you guys have? Too bright. All right, any question, anybody, about the back pain? You good? I did a good job then. No question.
No, but may I offer a comment to support what you said?
Uh-huh.
I've had back pain for
Yep.
I got away from it, now I gotta get back to it again. But if you wanna get better, you stretch, you do what he said you do, otherwise, it ain't gonna happen.
As I mentioned earlier, you need to learn to manage. Once you have a back pain, you need to learn to manage. Otherwise, you're just gonna be going door to door, different healthcare providers trying to find the solution. The first solution is yourself, okay? Yep. So what you want to do is understand your body, understand your pain, and work on it. Manage yourself first. I always tell people, manage yourself first. And then, if you can't manage it, we are here to help you. You know, but follow all those modification. Just do it 1 week, and you will see the difference for sure. Right now, any basic pain that you have, if you don't have that severe pain, follow this, and whatever the minor back pain you have, that will be gone. Okay? All right. So, we're going to do the special today because you all guys come here. So, many of you already know about the dry needle. We're going to give some discount if you want to do the dry needle. Today, we're just going to do it in $35. Normally, any new patient, if we have increased the price to $60 with the dry needling and cupping. Many patients, we already doing like $40 right now, but even in $40, we're going to give $5 discount. You can buy the sessions today, whatever you want to buy it. It's just $35 per session. That does include the cupping as well in the session. Okay, so the cupping and dry needling, we're just going to do in $35. So whatever you buy it, you can buy the package, you can buy single one, it's up to you. Okay, 30-minute sauna, we're going to do only $5. If someone wants to try it, we can do that too. Shockwave therapy, 25% off. Usually with the back pain, as I said, I would suggest to do the consultation first, to see if you're appropriate for the shockwave. Not everybody is appropriate for the shockwave. So, but again, if you are interested for any kind of ligament or joint pain, this is what we're going to do. All right. Now we're going to do our draw. You can get it.
Tell them what they won or what they can win.
So I'm going to do a little bit extra thing today, which I know they're not going to like it. So, yeah, we're going to do this one. Okay, so we're going to pick up one. So what is this? It's a KT recovery wave. This is really good product. It's a ring. Okay, it's a magnetic ring. Anytime when you feel like one side tightness, that okay, this side is just kind of tight, okay, or hurting, or like more muscular pain or something, if you just put this ring, it has 250 hours of battery. So it lasts pretty long time, okay? All you got to do is, and you can use it on multiple body areas, so not necessarily on the back. As you say, here it shows on the shoulder, but inside it will see like, you can use on back, neck, knee, shoulder, everywhere. It really helps with the pain, any muscular pain. Typically, this one is $22. But we're going to draw it and we'll see who gets it.
No cheating.
I don't know the number. Okay. 07206726. 6726. All right.
All right.
All right. Now
what?
I'm going to do one more. That would be for the dry needle. Dry needle.
One free session.
One free session. Okay? All right, let's see. The last 4 digits, 6727.
That's me.
All right. All right. Well, the dry, so you got the needling session then. One session dry needling.
Awesome. Yeah, I'm needy.
Yep. All right. So, any more questions? Anything that you wanted to go over? Okay. So, how do you think? Like, did you learn something today new? Do you think that something new information was there? Because the back pain is a very big topic. You know, we can cover a lot of things. If somebody attended my last seminar, it was totally different than this. Because we talked a lot about the ergonomics, like, the exercise and those kind of things. Today, I focus more about activity modification. Because I noticed that many people has the problem with that. Because if you don't start with that, you're not going to be able to manage your pain. Okay? So you wanted to do that. Okay? Every month, as you guys know, we're going to do some seminars. So I think next month, what, neck pain? Okay, there will be neck pain. There is a survey on your seat. If you can fill out, that helps me to understand how we can make it better experience, including food choices, including. So if you can fill out, I would appreciate that.
You guys can fill those out and pass them to me when you're done. I'll be at the desk if anyone.
You can put some bad comment about the speaker, no problem. You can put you can put the name. I'm fine with that.
But once you finish your survey, if you are interested in taking advantage of the dry needling discount or anything like that, I will be up at the front, ready to get you all taken care of.
All right. Thank you so much for coming.
Thank you for the lesson.
All right.